One of the top complaints that I see in my clinic as a gastroenterologist is pain in the abdomen or pain in the stomach. Okay. So as a doctor, I would like to share with you how I approach pain that's located in this area. We like to divide the stomach into 4 quadrants: the upper left, upper right, lower left, and lower right. Now, every area, there is a different organ. And in fact, in most areas, there are multiple organs. So when I ask a person where is the pain, I usually want to know which area is it related to. We look at a few characteristics of the pain. Where is the pain? Is the pain related to eating food? Is the pain better with food, worse with food, better with bowel movements, worse with bowel movements? Does the pain go anywhere? Some people will say pain goes to the back as well, or the pain goes to the left or goes to the right. So I'll give you some examples. If you have a pain that's located in the left upper side, the most common cause would be a stomach pain. But there are other organs there as well. You have the pancreas, which lies behind the stomach on the left. You also have the big intestine that runs around that corner. So I would look at the patient and I'll ask that person, how is the pain related to your meals? If the pain is related to food, it doesn't mean that the pain has to be better with food or worse with food. It can be either direction. But as long as there is a relationship to food, then the first thing that I will think of is the stomach, because that's where the food enters first. If they tell me that the pain has got nothing to do with food, but maybe related to passing motion, you get the pain, then you go toilet, pass motion, the pain gets better, then the first thing on my head I would think of is actually the big intestine. If the pain is in a person who is losing weight, or a person who is above the age of 40 to 50, especially 50 years and above, I will be more conscious, more careful, because pancreas can also cause pain that's very similar to a stomach problem. And if there's any sign that I worry about a pancreatic problem, then I will need to do, other than an endoscopy to check the stomach, I will do a CT scan to check the pancreas as well. If the pain is in the center, which is another common area, then I will want to know, is the pain related to food as well? Okay, and does the pain go to the left or to the right, or does it go up the chest? If the pain goes up the chest, then I tend to think more about reflux, because that's where the esophagus is. If the pain goes to the right, then that's not where the stomach is, and I would think more about the gallbladder, which is located in the right. But again, because the stomach is so common, then I would include in my investigation both the stomach as well as the gallbladder, which means that I would do an endoscopy to check the stomach, and as well as an ultrasound scan to check the liver and the gallbladder, but more focusing on the gallbladder, because gallstones are common. And gallstones are particularly common in people who are females around the age of 40 years and above, and especially in people who are overweight as well. And I see so many patients who have come to see me for pain, thinking that it is actually a stomach pain. They have been treated by primary care physicians with gastric medicines, and the pain is not better. Sometimes they have taken medicines for many years. And when I do an ultrasound scan, and I realize that, hey, you actually have a stone in the gallbladder. And when you go for the operation, suddenly the pain is gone completely. But then the reverse can also happen. There are people who have gone for gallbladder surgeries and they still have the pain. And then they realize that the pain is a stomach pain. So therein lies the problem, because we do not have a single test that actually can tell you where the pain is coming from with 100% certainty. One still needs clinical experience and a good history from the patient, as well as all the tests, to then put the whole picture together and then present what is the most likely cause. Sometimes we are not sure. It could be two problems as well. It could be the stomach problem together with the gallbladder problem, in which case we would say take the gallbladder out as well as take gastric medicines, and then the pain will go away. Okay. Pain in the lower half are different. Okay. The stomach doesn't go to the lower half. So generally pain in the lower half of the body, either left or right, usually requires an investigation of the big intestine, because the big intestine lies in the lower left, lower right, and upper right areas. Essentially, it's everywhere. And in females, we actually always think about the ovaries and the pelvic organs as well. So if there is pain in the front and it's in the lower quadrants, then they usually need an endoscopy, a colonoscopy, but not really a gastroscopy. And if we are not sure, we may need to couple it with a CT scan as well that goes down into the pelvis to look at the pelvic organs. People worry about kidney problems. Okay? Kidney problems usually present with pain that lies at the back, and that's usually a kidney stone, easily screened for with either an ultrasound scan of the kidneys or a CT scan. And the kidney presentation is very different. The pain is usually an aching pain that's located at the back rather than pain at the front. If there's pain in the front, it's usually a digestive organ or a pelvic organ pain. Less commonly a bladder pain, because bladder pain usually is situated in the center and there's problems with urination. So that is how we evaluate pain. There are times when the pain is right in the center, Okay, unfortunately, when pain is in the center, we have to think about almost every other organ. So patients who have pain in the center generally tend to end up with endoscopies first from the stomach as well as the colon, which can be done as a single procedure, and it's a very safe and low-risk procedure that takes only 30 minutes. And the risk is very low, it's like less than 1%. And we usually couple that with a CT scan of the abdomen. And once you have done these two tests, generally you'll be able to answer all the questions of where the pain is coming from and treat it properly.